There's a little bit more to do on the vagus nerve. There's a couple of little branches that we need to add on. I showed you a little bit of it last time. Yeah, we're just going to add those bits in because it kind of gets dragged down, and then as the body develops, some bits then well, that they loop up anyway, but as the organs drop down, it then stretches the nerve. I said last time, it's a bit like the phrenic nerve, which is C345, keeps the diaphragm alive. You've got a nerve specifically for the diaphragm, and obviously in a baby, it's very, very close to the neck. The diaphragm's close to the neck, and then as you grow, the nerve doesn't just stay the same size, it obviously has to grow with it. You get these nerves that then are pulled either side of the spine, and then on dissection you can see the pathway of those phrenic nerves, but obviously they weren't that long at the beginning. It's the same with the vagus. Because of where it goes underneath a couple of blood vessels. We're going to have a bit of a chat about those today, and that will then explain why it loops back on itself. You may have heard that. Let's just have a bit of a quick recap then. This is where we were last week. Just get rid of that. We've got the main cranial nerve summary table, which, let me just switch, there it is. This is what we've been looking at for the last few weeks, and we've been working through each of these nerves all the way down to here. Again, just for a recap, the nerve number is down the side here. We've reached number 10. We should do number 11 today as well. I should definitely do that. These are the exit points from the skull. This is where the nerve emerges. Where the nerves emerge, obviously cranial nerves, is either brain or brainstem. Some of the, like one that we'll see today, actually comes from the cervical region and then comes back up again. We've got another one that is classified as a cranial nerve. So it comes up through the foramen magnum, which is up through the foramen magnum and then through the jugular foramen. We've got a few nerves that all kind of join together, and you'll see that on the videos. We'll recap the ones that we did last week. It kind of gets dragged upwards and then exits the skull. All of these will exit the skull at certain points. And the last little bit that we'll probably get to next week is the hypoglossal canal, which sits just underneath the jugular foramen. If you've not heard of the terms before, a foramen is a hole. You'll see that quite a lot because obviously we're dealing with the holes in the skull. And yeah, there are some of the nerves literally travel within the skull. They don't just like go through a hole and then pop out the other side. Some of them do, but sometimes they actually travel in the layers of the skull and then pop out somewhere else. Not with the ones that we're going to have a look at today, but some of the previous ones have. We've got some specific routes that they follow. We've got the nerve names down here. We're at the vagus area and the accessory, which is properly called the spinal accessory nerve. Then we've got what they do. We've got whether they are sensory, whether they're motor, or whether they're both. In terms of the vagus, which we'll go into in a little bit more detail, that is both. And then the last two are motor. So they just activate either viscera or skeletal muscle. We'll have a look at those. We're getting to the region now where we're dealing with the muscles in the throat, back of the throat, tongue, thyroid area, larynx, pharynx. It's all that kind of throat area at the back of your throat. If you think where we started with the olfactory nerve, that was your smell, and then the optic nerve, your sight. And then as we've moved down the nerves, down the numbers, it's kind of moved down your head. Yeah, trigeminal was obviously everywhere, facial was everywhere, but doing a different job to the trigeminal. And then, yeah, as we've gone down, it's gone into ears and then into the tongue, roof of the mouth, the teeth, coming through to supply the face, and now we're down at this bit here. The problems that we have with the vagus nerve, not with the accessory, because that does something completely different, but the hypoglossal and the glossopharyngeal, those are all to do with speech, swallowing, gag reflexes, that kind of thing. Some autonomic function. And we looked at something last week called the uvula or uvula. That's the dangly bit at the back of your throat. And what muscles do that supply the back of the throat is they help to lift and lower that uvula so that you can swallow food. And if something gets trapped in there, then it's a protection to stop it going down your throat, basically. It serves a couple of purposes. One thing, because I've been reading up a little bit on it this week, just in readiness for this session, but the uvula is if you have a partner that snores, that is the reason for their snoring, because the uvula vibrates, and that's the, I can't even do, I don't snore, so I must have a very short uvula. But if you've got a dangly one, then that's going to vibrate quite a bit. We'll chop that sound bite and make that into a ringtone. Yeah, that's one of the reasons why you snore. There are people who've had it surgically removed because they snore so bad. So yeah, there you go. Again, every day is a school day. We're down here at the vagus. What else have we got? Yeah, this is what it does. We've got all of the functions of the nerve, and then these are the tests that you can do to test whether the function is good. What we'll do is we'll get down to here, we'll get down to 11, finish off next week, and then I'll do a recap of everything, but I want to focus on the testing. I'll run through a cranial nerve exam. I've done little bits as we go, but yeah, we'll just go through a checklist for an exam. Cool. Where are we? Yeah, this is an excerpt from that table that you've just seen there. We're at cranial nerve number 10, so the X. Where it comes out is the jugular foramen. We'll have a look at that again in a second. You've probably heard of the jugular vein. That's a vein that runs along the side of your neck. If you have a problem with the liver, then usually there's a bit of a backflow and you'll have a raised jugular venous pressure. You'll see this kind of bulge in the neck. So vagus is the name of the nerve, and then is it sensory, motor, or both? It's both, and it has loads of functions. We looked at this last week. General somatic sensory, we've got sensation for muscles, visceral sensation. We've got special visceral sensory as well, so maybe some autonomic function. General visceral motor, so activating some of the muscles of the gut. Special visceral motor as well, secretory functions. It does a hell of a lot. This is the kind of gut-brain axis that people talk about, as well as the enteric nervous system, the gut nervous system, basically. What do they do? We've got taste, heart rate, digestion, muscles of the throat. There may be a problem with digestion with someone. There may be problems with or changes in their heart rate, their taste. They may not be able to taste things as they once could. And the one thing that we can check is uvular deviation. We'll come to it, and then it will make sense why we do the test. This mnemonic here is to do with this section here. Is it sensory, motor, or both? So you write out all of your nerves, and then you write this next to it. Some say money matters, but my brother says big biceps matter more. And we're 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So cranial nerve 10. The vagus nerve is biceps, which means it's both. But again, if you're studying for exams, then that's a good way to remember what they do. This is the jugular foramen. That is the hole where your spinal cord will go through. The brain will obviously sit on the top here. We started at the front 7 weeks ago. We're looking at the olfactory nerve and the ethmoid structures there. Then we had the optic nerves. We had this orbital fissures where the sensation for the skin around the eye and the lacrimal gland, we're all going through there. Then we've got these foramen just a little bit further back for the trigeminal nerve. And we had the nerve, there's some little holes in there. In fact, you can probably see it there a little bit better. That's where your vestibular cochlear nerve went through. And then we're back here, which is the jugular foramen. There's a whole bunch of nerves that all go through this jugular foramen, and at the front of it, it's made the cranial nerves take up the anterior part of this, so the front bit there. And there are 3 nerves that pass through there. We've had a look at one last week, We did the vagus, and there's one more to do today. They all follow the same thing. This is the roadmap of the vagus nerve, and can look very confusing, but I think this is a really, really nice way to lay it out. And again, it doesn't look like this in real life. This is just a schematic so that it's easier to see where things go. We've got auricular branch, which is the skin around the ear. The vagus will supply the skin around the ear. The larynx and esophagus muscles. A cricothyroid muscle, which is the tensor of the larynx. That's important, that one, because of that uvular deviation. If the vagus nerve is involved in tensing those muscles at the back of your throat, if one side of your vagus isn't working, that isn't going to be able to tense and pull that uvula up. What happens is only one side contracts and then your uvula deviates, and that is why you get that deviation. So it deviates away from the side where the problem is, and the reason why that one is a problem is because it can't contract. That's why we get that deviation. We've got taste sensation, larynx, pharynx as well in this region here. Esophagus, trachea sensation here. If you have a look, there are these branches here. We've got superior laryngeal, and then that splits into two branches, an external and an internal branch. We'll have a look at those today. And then this one down here is the recurrent laryngeal. And you'll see it's a lot longer than these two. These two split quite high up and then go into the back of the throat. This one gets dragged down because of the blood vessels that it wraps around. Again, like I said, we'll go into a bit more detail about this on this session. And then we've got branches then that go to the heart and then to the abdomen. And we've got parasympathetic supply for the gut. That's what that does. Just a bit of a summary. It's a mixed cranial nerve. Vagus means wandering, so like a vagrant. That's where the name comes from. It's not V-E-G-A-U-S, so Las Vegas. It is Vagus with a V-A-G-U-S. It's widely distributed, massive distribution. Sensory for the skin of the ear, the taste buds, epiglottis, pharynx, proprioception, neck and throat. It will produce a gag reflex, and it will, if something's at the back of your throat, then automatically you then either get rid of it or you swallow it. And that's what this nerve will help you to do. We've got baroreceptors. Remember, they were pressure sensors. If you think about a barometer, it measures air pressure. The baroreceptors measure the pressure in your blood, and the vagus nerve will receive information from the carotid sinus, which is like a bulbous part of the carotid artery. And we've also got chemoreceptors. They're chemical receptors in the carotid and aortic bodies. They're detecting the levels of oxygen in your blood. We've got this feedback to the brain from this nerve about the blood pressure and the oxygenation in your blood. That's a pretty important job. Motor part, we've got pharynx, larynx, soft palate, so for swallowing, vocals and coughing, hence the gag reflex and being able to move the muscles at the back of the throat. Parasympathetic for your lungs, your heart. It regulates resting heart rate, your GI tract. Remember, parasympathetic is rest and digest. That's its job. We've got respiration, esophagus, stomach, gallbladder, small intestine, most of the large intestine, increasing peristalsis and gastric emptying. That's part of its role. This is just an image. If you search vagus nerve, then you'll see something like this. And this is what it looks like for real, hopefully. Here we go. The first bit of this we've already seen, and then I've added a little bit on this week. We've got a little bit more detail. We've got vagus nerve, the vagrant. This is the slide that we saw before. If you wanted to use this video as a recap, then you can. Here we go. The view that we've got, this is the back of the brain. Imagine that someone's looking at the back of your head. They've taken the back of your skull off. Nice. And then you're looking at the back of the brain stem as it gets. So this bit here is your spinal cord. There's a big lumpy bit at the back of the brain stem called the cerebellum, and that's been taken off so that we can see these nerves, basically. And we've got three all bunched together. All right, like I said, we saw one last week, well, two last week, and then we're going to add another one on today. All right, if we pay attention to that one too. Here we go. We've got nerves 9, glossopharyngeal, 10, vagus, and then 11, the spinal accessory. And you can make those out just about here. The spinal accessory is, I think, is a little bit lower than that actually. So the number 9, the glossopharyngeal, we covered that a few weeks ago, and that's quite a thin cranial nerve. There's not much to it. The vagus is massive, so it spreads out, fans out, and then goes into a point. And then the spinal accessory starts in your cervicals, and we'll have a look at that in a sec. And then that all then joins together and then goes through the same hole up here. All three of these go through the jugular foramen. They all go through the same bit. Let's have a look at that. There we go. 9 and 10 are very close to each other just there. And you can see them better on that picture. There we go. There's your glossopharyngeal. That's quite thin. See that one there? All of that underneath, that's vagus. It's kind of like a mini cauda equina, you know, in the horse's tail that we've seen in the lumbar spine, where we've got all those nerves coming together. All of these nerves coming together and then into that point there, and then this one will be accessory coming up here. Let's have a look at that. That's number 9. All of that area is number 10, so that's your vagus. Spread out all across there, all the way there. And they all go through that jugular foramen. I remember that being quick from last time. Let me just get ready on the pause button. Bear with me a sec. Yeah, spread out vagus all the way down into a point. And then just pause that there. Cool, just move me up here. We've got jugular foramen, which is the start of that schematic. Just to give you a bit of an orientation, it's come straight off the brainstem and then through that jugular foramen, and then off it goes. That's this point just here, is that point there. Outside of this jugular foramen, as soon as it goes through that hole, that's when it starts to branch off into places. Let's have a look at that. Let's just pause that there. This was the picture that I showed you earlier. That's what the jugular foramen looks like in a dry skull. This is one of the models that I've got. And then there's your foramen magnum, which is basically means big hole. And that's where your spinal cord goes through. That'll be down here, out of the way there. Yeah, just move me there. There's your jugular foramen just there. And you'll have glossopharyngeal going through, vagus, and this one here, which is the accessory, which we'll look at in a second. Yep, there's your jugular foramen. And I'm just zoomed in on that schematic there. The middle compartment of the jugular foramen, that bit there, that's where your vagus will go. The anterior part of the jugular foramen will be glossopharyngeal, then the middle part will be vagus, and posterior will be accessory. That's where they all pass through. And then I think it just switches to the other side of the skull, yeah. We'll see as it emerges. That's where it comes out, just there. It's quite a large gap, deep to the mastoid process, so right up there. And there is no way that you can push into that area there, unless sternocleidomastoid has been removed. That one there, this is one that we're going to need to know. This is the last one, cranial nerve 12. This is where the hypoglossal nerve goes through. It's got its own little canal there. Very, very close to the jugular foramen, but just underneath it. We will start to layer some of the tissue on. 9, 10 and 12 come through that region, and 11 as well. And we've got 4 cranial nerves all together here. And for this particular video, we're just going to be focusing on the vagus. And we'll have a look at accessory next. Yeah, that, I don't know whether you can make it out there, but it's quite dark on my screen. But can you see there's a couple of blood vessels? There's that one there, that's your jugular vein. And then just in front of it, that's your carotid artery, the internal carotid artery. It's right on the side of your neck, basically. That's where your styloid process will be, right behind the ear. Glossopharyngeal just there, and then there's the vagus. That's the one we're interested in. There's the accessory. We're going to have a look at that in a second. The accessory goes this way. It goes towards the back of the neck, and that's key because that shows you where it goes to and what it supplies. The vagus goes down and the hypoglossal goes kind of forward. The orientation of those around that area will give you a clue as to where they supply. Hypoglossal comes down there too, and we'll look at that next week. The posterior digastric has been removed and the mandible's been removed as well. So you can see it's well protected. They are chunky old bits indeed, Stevie. Yeah, they definitely are. So there's your vagus nerve. So internal jugular vein is here. That's going down from the brain. The internal carotid is going up towards the brain. Oxygenated blood up, deoxygenated coming back. And then this is the vagus. So it sits in between those two vessels, right in between those two. Yeah, carotid artery just there. There's your vagus. And then we're going to see some, hopefully, see some branches of the vagus in a second. Yeah, the vagus runs in between the blood vessels as it comes down. And then there are some branches then that come off of that around the middle part of your neck. There it is going all the way down, and it kind of enters the top part of the thoracic cavity. So your clavicles would be here. We're looking at this region here. It's coming all the way down, tracking down by your carotid artery, and then sinking down into your chest wall through where the pleura of the lungs will be. The first rib is just there. Where are we here? Yeah, cool. Just pause that there. Yeah, these are the different branches. This is another zoomed in section of that big schematic. One of the branches that I mentioned before was the pharyngeal branch. So it goes by your carotid arteries, which is this picture here. We've got the vagus there, and then we've got this pharyngeal branch that comes off here. This is going towards your pharynx. Right, let's just have a look at that. And there's your superior laryngeal. That was the next one down, okay, on that schematic again. Pharyngeal was up here. This is the superior laryngeal, and then that splits off into two branches. So we've got an external branch that goes towards that cricothyroid muscle, and then we've got an internal branch that goes to the around the pharynx and larynx area. Okay, what we've got, epiglottis, vocal cords, and it's above the vocal cords as well. And that's really important because it's that bit that lifts the throat with swallowing. And that's one of the reasons why if you have a problem with the vagus nerve, you get that uvular deviation. Okay, so there's your superior laryngeal. We'll have a look at these in a bit more detail as we go through. These bits are added on from the last session that we did. There's your pharyngeal again, and we're going to have a look at where that goes. And there it is there. Cool, I'm just going to move me out of the way again. I seem to be in the way a lot. It supplies the constrictor muscles. We had a look at those last week, kind of on the side of the neck. Muscles of the palate as well, except a particular muscle, tensor palati. We're looking at this kind of region of your throat, the pharynx region of your throat. It supplies the muscles in that particular region. And it also supplies the back, well, basically the palate, the back of your throat around here as well. Okay. And then we've got the superior laryngeal branch, and that splits into two, external and internal. We're going to follow the pathway of those as well. There's the superior laryngeal as it goes down, and you can see where the throat is on this. It's a really good dissection. There we go. You can see the trachea. That's where the hyoid bone would be. And we did a whole session on hyoid bones. That's literally just under there. If you kind of hold your chin like that, draw down your chin, squeeze in from the sides, and you should be able to feel two bony lumps. And those bony lumps are the sides of the horseshoe-shaped hyoid bone We've got muscles that attach onto that hyoid bone and come up into the bottom of the chin, and then from the hyoid down onto the ribs and also onto the scapula. It's kind of like that hyoid bone helps with swallowing as well. That's where we are. There's your thyroid cartilage, so just underneath that hyoid. And then the superior laryngeal nerve is that one just there. It's coming down and literally just going straight into that larynx region. Okay. External branch and then internal branch. They're quite close to each other. Let me just move me out of the way again. And then, yeah, so the internal branch goes through anywhere on the diagram where it's got a circle like this, it's going through something. And we've got the thyrohyoid membrane, which is this bit here. So there's your hyoid, there's your thyroid, and then there's a membrane in between the two. The branch, the internal branch of the vagus, will come through that membrane. The internal branch passes through the thyroid membrane. That's how it gets into that region. This is all this area around here, and then it provides sensation to the mucosa of the larynx and pharynx above your vocal cords, also your epiglottis and valliculi, and then we've also got the taste sensation in that region as well. Remember when we were saying right back at the beginning that we've got special visceral senses? That will be things like taste, but it's not something that is like a regular sensation, like heat, cold, sharp touch, soft touch, that kind of thing. This is detecting taste sensation, but it's a special visceral sense. That's why it's given that particular term. Sensation to all those areas. And then, here we go. And then the external branch goes towards this cricothyroid muscle. This is another zoom in of that schematic. And there's the cricothyroid. Inferior constrictor. Muscles, basically, around the pharynx and larynx. And then your recurrent laryngeal. Now this is where it gets a bit interesting. Just to give you a bit of an orientation, this is your collarbone. That is the edge of your trapezius by the looks of it. It looks as if the sternocleidomastoid has been removed. This is looking at the front of the chest. We've got the recurrent laryngeal. And if you have a look at where it supplies, the mucosa below the vocal cords, including the upper esophageal and upper trachea. It's the lower section of the throat. We've got the intrinsic laryngeal muscles as well. The vagus supplies the top part of the pharynx and larynx and the bottom part as well. That's why it aids with swallowing, because alongside the glossopharyngeal and the hypoglossal, it helps activate those muscles so that it moves things up and down in your throat. The recurrent laryngeal has a bit of an odd pathway. That's where your jugular vein would be. They've taken that out, so we've created a window here, and underneath that you've got the subclavian artery. You can just about make it out there. There's the common carotid, there's the vagus nerve coming down, and then there's the subclavian artery just there. This is literally just coming off the top of your heart, and we've covered this before when we looked at the thorax. The subclavian artery will go down your arm, and then the internal carotid will go up towards your head. They're from the same vessel, the brachiocephalic vessels. But if you have a look at what happens to the vagus, can you see that there? And then it gets caught on this subclavian, okay? And it then loops back on itself. All right, but obviously in an infant, it would be all close together. There's your recurrent laryngeal. It wraps around that subclavian, and it also, on the left side, this is your aorta. We had a look at this. I've got a better image of this later. There's your aorta. On the left side, it gets caught underneath the aorta. Yeah. On the right side, it goes underneath the subclavian artery and gets pulled down as you develop, and then on the left side it's underneath your aorta, the arch of the aorta. So the vagus nerve gets stretched, or the recurrent laryngeal part of it, and then it loops back to your throat. That's why it's called recurrent laryngeal, and one side longer than the other. And that's the reason why, because of where it gets kind of trapped onto, if you like. This is the right side. There's your internal carotid, and that's where it wraps around. The carotid artery's been removed. Look at that. That's how it wraps under. It comes down and then loops back on itself, and then there's your throat just there. Okay, this is all in the throat. That's why it's called recurrent laryngeal, because it's coming back, and then all your infrahyoid muscles. There's your trachea. This is where your thyroid will be. Muscles, so the cricothyroid muscle, and then there is your recurrent laryngeal. It's gone down the neck, looped underneath subclavian, and then come back up the trachea again. And then there's some little arteries there that it crosses over. It's an interesting pathway, and then yeah, it's all of the intrinsic laryngeal muscles and in the lower part of the throat. The recurrent laryngeal does the lower part of your throat, or the activation of the muscles in that region. And sensation for the bottom of the throat as well. Yeah, let me just go back there a second. We've got where it splits, we've got intrinsic laryngeal muscle. This is motor, and then we've got sensation for these regions here, the mucosa below the vocal cords, the upper esophagus, and the upper trachea. It's all the kind of back of the throat sensation as well. It's got quite a few jobs, this vagus nerve. And this, what we're just showing you there, just builds on from what we did last week. There's the sensation for that region there. And then this is where we finished last week. There's your heart. There's your trachea. This is the right side vagus coming down, and it comes all the way down by the esophagus, and then it will enter the abdomen through the diaphragm. So there's your heart, there's the arch of the aorta, and there's your left vagus and the recurrent laryngeal, because it's got caught underneath that aorta. The recurrent laryngeal will come underneath that and then back up towards the throat again. And there it is just there. It wraps around the aorta. Brilliant. Okay. Where are we? Need to go back to that one. Cool. So that finishes off that vagus nerve. Hopefully that all makes sense. We've alluded to this a few times. To test the glossopharyngeal and the vagus together, you do this. There's a uvular deviation, and like I said, the problem will be on the side that it's moving away from. The glossopharyngeal and the vagus will contract those upper throat muscles, and if one side isn't working, then it won't contract. Normally, as they pull up, the uvula will just move up in the middle. But if one side isn't working, it will move only on one side, and it'll pull that over to that side. The problem is not on the side it's going to; it's the side that it's moving away from. That's why we do that test. You use a tongue depressor, and the person gets you to say ah, and as you say ah, it contracts the muscles at the back of the throat, should lift the uvula, but if it deviates, then we know that there may be a problem. Cool. Now this one is nice and quick, nice and simple, just does two things. Woohoo! Thank God. We're at number 11. Where does it come through? It comes through the jugular foramen again. It's called the accessory nerve, but more accurately the spinal accessory. It is purely motor. We've got general somatic motor and then special visceral motor. It's got two functions. What does it do is that main function is the muscles of the neck. Okay. It is the motor supply for trapezius and sternocleidomastoid. Those are two big muscles in your neck. If you can't turn your head against resistance, then there may be a problem with the spinal accessory nerve. If you can't lift your shoulders, then there may be a problem with the spinal accessory nerve. By shrugging and rotating the head against resistance, doing a normal kind of cervical exam, active resisted exam, you will be testing the spinal accessory nerve. This is the mnemonic. It's number 11. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. We land on matter. Because it begins with an M, it must be motor. This purely motor. Nice and easy. It comes up through the foramen magnum and then exits through that jugular foramen. That's what I was saying before, yeah? On that first video, we saw the vagus nerve. You could see just coming up through the bottom was the spinal accessory, and then it joins in with the glossopharyngeal and the vagus. They all come together and go through that jugular foramen. But it's come up from the neck. It's come up from the neck. So it looks like this. The origins of it are from C1 to C5. The spinal roots, spinal nucleus and of number 11 is from C1 to C5. And then this is all in the cervical region, but instead of going down towards the arms, it's going back up through the foramen magnum, through the big hole where your spinal cord goes down, and then it joins in with the other cranial nerves, 9 and 10, and then goes through that jugular foramen, very close to the vagus nerve, which is what we saw before. And then if we have a look, then it then exits transverse process of C1 and then goes towards the trapezius and sternocleidomastoid, and that's its only job. So this is a nice easy one at last. What does the accessory nerve do? If you go, I don't know, then you're halfway there, okay? Because it does your trapezius. Yeah, the sternocleidomastoid turning your head, and then shrug is your trapezius. Can they shrug and can they rotate their head? The test that you do is this one. Nice and easy. It's a manual muscle test for sternocleidomastoid rotation and side bend rotation and shrugging the shoulders. It's as easy as that. The spinal accessory is dead easy to do. This is what it looks like. Last video, promise. That's just what we've seen. And here we go. If I just pause that there. We saw where it came from in the last video, and then up round here is your jugular foramen. That's where you got your vagus, you've got your glossopharyngeal and your hypoglossal all coming through that similar, well, hypoglossal for a different exit point, but all through that kind of region there. You've got your, looks like external auditory meatus there, that's your ear roll, and there is your jugular vein. So it's very, very similar images to what we saw before. We saw the spinal accessory poking out the back on the last one. We're just going to follow that along now. Here it goes here, look. This is going posteriorly, and it's going towards, so underneath the digastric, over the top of the scalenes, towards your trapezius. And then there's your sternocleidomastoid, just on top of it. It supplies your sternocleidomastoid. There's a branch that goes off there, and then down towards your trapezius, and you can just see it going there. There it goes. The spinal accessory number 11 off towards your trapezius. And that is the quickest of all the cranial nerves, you'll be glad to know. Good. We have got, just get rid of that, we've got one more to go. The last one, what time is it? Perfect timing, good. Yeah, part 9 cranial nerves. I can't believe it's taken 8 weeks to go through all of them. To be fair though, you can't, these aren't things that you can just learn really easily. You need to go over them again and again and again if you really want to know them well. Just having an awareness though of them is really, really key. And if you've got a structure to follow, which I'll introduce you to next week, then you can't go wrong. Yeah, because you'd have just covered yourself. Now you know about these things, it increases the depth of your clinical reasoning. We talk about clinical reasoning quite a bit on social media. And I think the problem with some things is, I mean, for me, I've talked about this before, when I was a sports massage therapist, my clinical reasoning was that it's a muscle. whatever hurts, it's a muscle, because that is all I knew. And then once I started to learn a little bit more about the anatomy and the other structures around and referred pain and then pain science and all that kind of stuff, you realize that there's other things that may be causing those issues. And that's when your clinical reasoning knowledge grows and you've got more things to add into the mix. But to add them into the mix, you need to be able to test them. I'll show you that next week.